Welcome to our service. हिंदी के लिए एक दबाएं. For English, press 2. KNND க்காகி 3
Two.
ஒத்திரி. தமிழுக்கு 4 அழுத்தவும். தெலுங்குக்கு 5 knock and D. Please select your preferred language.
Two.
Great. Let's continue in English. I'm Saathi, your health assistant. I'm here to help you document patient visits quickly and easily. Let me start by asking, where are you conducting this visit? For example, are you at a village health center, UPHC, dispensary, or another location? Could you tell me the name or type of place?
So I am at a rural place in Jharkhand and
Thank you for letting me know. So you're in a rural area in Jharkhand. That's helpful. Now, could you tell me the name of the village or the specific health center where you are right now?
it is PSC Changadda, Ramgarh, Jharkhand.
Perfect. Thank you. So you're at PSC, Changarda, Ramgarh, Jharkhand. Now, what is today's date and time? Or shall I note this as today's visit?
So it is 14th April 2026.
Got it. So the visit date is 14th April 2026. Thank you. Now, let me ask about the patient. What is the patient's name or initials?
Patient name is Astha and her age is 26 and she is 1 month pregnant and her BP is low, like 100 out of 180.
Thank you for that information. Let me confirm what you've shared. Patient name, Asthand. Age, 26 years. Gender, female. Pregnancy status, 1 month pregnant. BP, reading. You mentioned 100 out of 180. Let me clarify. When you say 100 out of 180, do you mean the systolic is 100 and diastolic is 180? That would be unusual. Could you
No.
please repeat
That
the
is
BP
like
reading
systolic
slowly?
is
What is the top?
Systolic is 100 and diastolic is 80.
Perfect. Thank you for clarifying. So the BP is 100 systolic and 80 diastolic. That's noted. Now, besides the low BP concern, what are the main symptoms or reasons for this visit today? Is she experiencing any dizziness, weakness, headache, or other concerns?
She is experiencing itching and little pain on the abdomen and little dizziness and due to her low BP.
Thank you. I want to make sure I understand clearly. You mentioned abdominal pain, dizziness. Could you help me understand the last point you mentioned? You said uterolobe P. I'm not quite sure what you meant. Could you say that again or spell it out for me?
So it is dizziness is like she is experiencing due to low BP.
I understand now. Thank you for clarifying. So, the dizziness is related to her low BP. So, to summarize the symptoms, abdominal pain, dizziness due to low BP. Now, let me ask about other vitals. Do you have her temperature? And also, what is her pulse rate?
Temperature is 97 degree Fahrenheit and pulse rate is 98 BPM.
Temperature is 97 Fahrenheit and pulse rate is 98 BPM. That's noted. Now, do you have her oxygen saturation, SpO2 reading? And also, what is her weight?
PO2 is 100 and weight is 58.
Perfect. Thank you. So SpO2 is 100% and weight is 58 kilograms. That's all noted. Now, given that she's 1 month pregnant and has low BP with abdominal pain and dizziness, this could be concerning. Has she experienced any severe headache, blurred vision, vaginal bleeding, or leaking fluid? These could be important signs during pregnancy.
No.
Thank you for confirming. Now, what actions or tests have you done or planned for this patient? For example, have you done any blood tests like hemoglobin, blood sugar, or urine tests? And what medicines or treatment have you provided?
So I have done blood test and urine test and her hemoglobin is 9.8, her sugar is normal level and urine tests are yet to come. And I've asked her to eat iron rich foods like palak and eat a well balanced diet rich in iodine and do regular exercise, eat optimal food, and I've given her iron and little vitamins and little general medicines for her low BP count.
Excellent. Thank you for that detailed information. Let me confirm what you've done. Tests done. Blood test. Hemoglobin is 9.8 grams per deciliter. Blood sugar, normal level. Urine test, results pending. Counseling provided. Eat iron-rich foods like spinach, palak. Eat a well-balanced diet. Do regular exercise. Eat optimal food. Medicines given. Iron supplement, vitamins. General medicines for low BP. Now, have you referred her to a higher facility like a hospital or a PHC for further evaluation? And what is the follow-up plan? When should she come back for her next visit?
I've not referred her. I have asked her to come next week for next visit for her follow-up.
Got it. So no referral at this time, but she's been asked to come back next week for her next visit. That's noted. Now let me recap all the details we've documented for this patient visit. Patient, asked hand, 26 years old, female. Location, PS, C. Changarda, Ramgarh, Charkhand. Visit, date, 14th April 2026. Pregnancy status, 1 month pregnant. Reason for a visit, low, BP, abdominal pain, dizziness. Vitals, temperature 97 degrees, BP 180, pulse 98 BPM, SpO2 100%, weight 58 kilograms. Tests done. Blood test, hemoglobin 9.8 grams, DL, blood sugar normal, urine test pending. Counseling, iron-rich foods, spinach, well-balanced diet, regular exercise, optimal nutrition. Medicines given, iron supplement, vitamins, general medicines for low BP. Referral, none.
That's fine.
Thank you for confirming. Is there any other patient visit you'd like to record today?
No.
Perfect. Thank you for using Saathi today. Your patient visit has been documented successfully. Take care.
Sure.
Thank you for using Saathi. Your patient visit has been documented. Have a great day.